Existing infectious disease surveillance hasn't changed much in 50 years, measuring and reporting the same thing, the caseload, in terms of new and cumulative deaths and infections. The existing system doesn't identify what public health leaders need most in the COVID-19 pandemic, which is identifying and sounding the alarm around significant shifts in acceleration of disease transmission and thus signaling an outbreak. Which is why Dr. Lori Post and team at Northwestern University developed the first dynamic global surveillance system that tracks and reports not just where the virus is now, but where it is going, how fast it will arrive, and whether that speed is accelerating.
We're taking the pulse on countries around the world. It's updated every single day.
The new system, along with follow-up around its use in other countries, including the Middle East and North Africa, was first published in the Journal of Medical Internet Research. Northwestern is hosting the new COVID tracking dashboard, open to anyone, with the new metrics as well as traditional ones. In total, the dashboard reports on 195 countries.
Our surveillance also serves as an early warning system, so we're able to identify places where an outbreak is going to happen unless somebody does something immediately to turn it backwards.
On October 5th, 2020, Dr. Post published Dynamic Panel Surveillance of COVID-19 Transmission in the United States to Inform Health Policy, an observational statistical study, where she introduces and explains how the new metrics of speed, acceleration, and jerk, the change in acceleration, were developed and validated. On December 3, 2020, Dr. Post published Dynamic Public Health Surveillance to Track and Mitigate the U.S. COVID-19 Epidemic, a longitudinal trend analysis study, where she highlights how these new metrics of speed, acceleration, jerk, and persistence can better inform us of explosive growth. At the state level, the indicators suggested that explosive growth occurring in North Dakota, South Dakota, Wisconsin, and Wyoming could have been identified as early as late October. The idea is that each country's dashboard will be monitored in every U.S. embassy in the world to inform policy leaders around the globe, including Sub-Saharan Africa, the Middle East and North Africa, and East Asia and the Pacific. The dashboard was made possible in part through support provided by Feed the Future and a Davey Innovations Research Endowment grant. At JMIR, we're humbled to have such brilliant scientists publishing their game-changing science in our journals.